is really when we're talking about naturopathic medicine, wow, it's a calling. People will say to me all the time, gosh, I didn't know this existed, and I found out about it, and wow, I can't see myself doing anything else. And so today we're going to talk to you a little bit about what that is that drives people to follow their passion, to do something that is so deep within their heart and so aligned with their own personal values. And so that's what we're going to be covering today. I graduated from the Southwest College of Naturopathic Medicine in 2000, went on to do residency and then practiced and taught for a number of years prior to coming on with the ANMC. So that's a little bit about me. And any questions that we have during the course of the webinar, I will take during the Q&A section. So there is a little question box on your control panel that you can open up and expand. And that will give you a way to interact with me. Now, while I'm doing the webinar, I'm not going to be able to answer questions immediately, but I will get to them during the Q&A section. And the other little piece of housekeeping is we will have a recording of this that will be available about 48 hours or so after the start of the webinar. And so I think somebody asked for my full name. And so there's my full name, Kelsey. And it's also up on the website if you want that as well. So again, I'm JoAnn Yanez. I'm the executive director for the ANMC. So with that, what is naturopathic medicine? Well, it's so funny for me. I'm asked this question all the time, and the answers are often pretty similar, but it's nuanced. So naturopathic medicine is this individualized system of care, and it really uses the body's innate ability to heal itself. It's the art and the diagnosis and treatment of really focusing on prevention whenever possible, and using natural therapies. And so when you're talking about naturopathic medicine, you're talking about somebody who is focused on the whole patient, who's focused on the underlying root cause of the issues, and is going to do so in the most natural of ways as possible. However, we are always focused on patient safety, and so NDs are trained to refer when appropriate, to work with specialists, and to give really whole patient care that's patient focused. So I talk to folks a lot about the history of naturopathic medicine, and in some regards, our somebody is saying that the slides are not matching my talking. Let's see if I can fix that really quick. It should be working. So I'm advancing that, and it should be working. Let me know if that's not working. I think it should be working now. So oftentimes, nope, I'm not on slide 1, Danielle. All right, well, let's get this slide thing fixed before I move on any further. Well, give me a second. Let's see if we can get this fixed. All right. So let's see here. Let's see if we can get this working for us. View slideshow. Hopefully that'll work now. All right. We see the slides. Awesome. Okay. Little technical difficulties here. So odd. Okay. All right. So now that glitch is going, so now the slides match. So oftentimes folks will ask me about the history of naturopathic medicine, and as an organized profession, it dates back to the 1800s. However, when you think about what NDs really use, it isn't just 1800s European therapies that are incorporated in the naturopathic model, there's so much more. So we have grads who are fascinated with and work with traditional Chinese medicine. There are folks who study Ayurveda. There are folks who work with South American herbs and African herbs and Caribbean medicine. And I think that the biggest thing for me, uh, not to use a pun, but when I'm thinking about the root, haha, of naturopathic medicine, sorry, I'm a little silly today. When I think about the root of naturopathic medicine, I really do think of, it is as old as people recognizing that there are things around us that we can use to heal, and that sometimes that healing lies within ourselves. And so when I'm thinking about really what is naturopathic medicine, it's honoring this innate ability to heal ourselves and using the most natural ways possible. So naturopathic medicine is focused on the six principles. And so when we think about the six principles, these are really core to what makes a naturopathic doctor a naturopathic doctor. And so regardless, and oftentimes I'll hear, well, is it naturopathic to be using conventional diagnosis, or is it naturopathic to even maybe be considering a pharmaceutical? And I say absolutely, because as long as that practitioner is following these six principles that are on your screen, and the therapeutic order, which I'll go into next, they're really utilizing all of the tools that we have to treat the patient and to really focus on what's best for the person. So first, do no harm really is the core of all practitioners, all medical practitioners. And so first, do no harm means that we're going to really try and use the least invasive and therapies that are not going to harm patients whenever possible. Identifying and treating the cause is core to naturopathic medicine. And what that means is, and you see there's a little, this is my son's, it was just a little prop here. But it's a magnifying glass. And because I think of naturopathic doctors as detectives, and actually we do a monthly newsletter, and we have NDs often talking about, why they love naturopathic medicine. And one doc just recently interviewed said, because I get to be a detective, I get to uncover what is the real issue. And later on, I'll talk about, maybe I'll get to a case or two. But really, I think where NDs shine is we don't quit. We continue to really look for the roots of the issue and address that. So we treat the whole person. And so when we're treating the whole person, what that means is we are focusing on mind, on body, and on spirit. And that is really from a holistic perspective. Sometimes issues are with what somebody is eating. Sometimes issues are with lifestyle issues. There are genetic issues. There are so many different issues. Sometimes it can be relationships. Sometimes it can be work. And so, unless we're really seeing a whole person and a whole patient, we're not going to be able to get that snapshot of what the real cause is for that person. And so I always think of the example of headaches. Show of hands, who's had a headache? And when I think about, and I see the hand thing popping up, yes. So when I think about headaches, I think of all the different things that could be causing a headache. So you could be dehydrated. You could maybe be hungover. Maybe you haven't slept enough. Maybe you've eaten something that has not felt good in your body. Maybe there's a brain tumor. And so when an ND is focusing on a patient, first we're going to diagnose the person. We're going to figure out what is that cause. And then once we've done that, we're going to address the cause and address it as naturally as possible. So in that tumor case, bye-bye, go to conventional medicine, get diagnosed, and let's work together to get you treated. However, and we may be able to support that process as well. But with other things where lifestyle issues may be the cause, NDs are going to work with that whole person. And we recognize the healing power of nature. And by that was what I was talking about a little bit earlier. That's the innate ability to heal ourselves, as well as really looking around us and what is it that we can take from nature and help us to heal. Physician is teacher. And so this is one thing, I always ask folks. So, how many people think they know what doctor means? And the root of the word doctor is Latin from docere, which actually means to teach. And so, naturopathic doctors, we take to heart that our role as a physician is really to teach you optimal health. And so, when we're working with patients, we're not just there to say, okay, this is your diagnosis and here's your treatment, see you later. It's, this is your diagnosis. This is probably why we have what's going on. Here are some things that you can do to help yourself. And here are some things that you can do to prevent this from happening in the future. And let me teach you how to live in a way that won't set up this disease from happening again. And so that is the role that NDs take as physician as teacher. Prevention is also key, and that was a little bit hinted in that last thing that I talked about with physician as a teacher, is we're focusing on helping folks prevent disease in the long term. And so I talk to legislators, I talk to insurance company people and folks in academia all the time. And I always think, I lost a grandmother to complications of diabetes and heart disease, chronic heart disease and obesity. And I always think, what would have happened in her early years if she had been taught the root of why she was obese, why she overate, why she stress ate, and really, to teach her how to love herself and how to have a good, loving relationship with her body and her food, and that maybe some of those things might not have happened. I might have had my grandmother a bunch more years than losing her at the age of 62. So, for me, it's personal. And I think what you'll see with a lot of naturopathic doctors is there's often a personal journey to naturopathic medicine, either with loved ones or with their own personal health, and seeing that there are other ways to treat illness. And so core to that, when I think about patients and guiding patients toward health, one of my teachers early on shared with us the arrows. I call them the arrows of death, and really, spoke to our role to help guide patients toward health. Now, sometimes, things happen and that we spiral, and it's not really a direct arrow, but it's more of a spiral. But that ultimately our goal as naturopathic doctors is to guide people toward the healthy end and hopefully steer them away from death. And now the other thing that I always think to my early naturopathic doctor classes when I was in school, and one teacher stood out for me so much by saying, and it's one of those things when somebody says, if you remember nothing else that I tell you, remember this. It was one of those moments. And he shared, he said, if you remember nothing else about naturopathic medical school, remember the next thing that I'm going to tell you. And he said, very short little sentence, it's all about the relationship. And I thought about that. Like, what does that mean? It's all about the relationship. And he expounded on it. He says, okay, well, it all boils down to the relationship. You can have the best treatment plan, you can have all the awesome things, but if you haven't built rapport and built a relationship with your patient to help them understand why these things are going on and help you understand what's going to make sense for them, you've lost the battle. And so with that, I've always had those words kind of etched into my brain. It's all about the relationship. And in all honesty, in life, it's often all about the relationship. It's the relationship that you have with work, with your family, and all of those relationships that either support us or hurt us, that has such a large impact in our health. And so with that, there are, some naturopathic therapies that I use on a consistent basis. And so, I think when you're in naturopathic school, some therapies will resonate for people and they will be so drawn to one. And other folks will say, you know what, I love them all. And some folks will say, I love them all, but this one. And all that's okay. I think, everybody has their path. And just like, when you're in undergrad or you're studying some sort of topic in school, not everybody is going to love every single topic, and not everybody is going to be as strong in every single topic. But I think at the end of the day, all of the things that I learned in naturopathic medical school are so useful, not only for me, from a clinical perspective, and I'm no longer clinically practicing, but also for me just in my own health and the health of my family, and understanding my body's relationship with its surroundings. And so botanical medicine is something that I highly value. Clinical nutrition, I think, is core, and is so lacking in the conventional model today. So much of what folks struggle with has at its core nutrition or lack thereof. Counseling, mind body medicine, our thoughts, our response to stress, our coping mechanisms are vital. Manual medicine, which is the healing power of touch, traditional Chinese medicine, and laboratory and clinical skills. And the biggest thing, though, that I kind of hinted at with that, it all boils down to the relationship, is healing often lies in that doctor-patient relationship. And so I think that what I'm trying to get at here is really that so often that doctor-patient relationship, the chance for a person to feel safe and vulnerable, is so powerful. And naturopathic doctors are trained. And I think the folks that are drawn to this type of medicine are really looking for that. They're looking for something else. They're looking for a way where they can have that relationship with a patient, really help them get to the core of the issues and stimulate real healing. And so at the end of the day, those are the types of things that I think, for me are of the greatest value as a naturopathic doctor. And that healing power of the relationship, I think you have to mention that. So the next slide that I have, I titled it "Think Like an ND." And so what the heck does that mean? Well, think like an ND to me means, when I'm in medical, when I was in naturopathic school, my anatomy course was the same type of anatomy class that any other doctor got. We had cadavers. We smelled like formaldehyde. It was medical school. Our biochem was biochem. Our histology was histology. All those courses don't change because, the bones don't move just because you're going to naturopathic school. And so for me, what I wanted to understand was, okay, well, what is our strength? What does separate us out from conventional medicine? Because we are studying diagnosis, we're studying treatment, we're studying labs, we're studying pharmaceutical drugs and their interactions, and how they, how some of them will deplete certain nutrients in the body, and we've got to beef that up if somebody's on a med. We learn all of that. And so for me, it was what really differentiates naturopathic doctors, and it's how we think. And so thinking like an ND to me means that we're following the therapeutic order. And the therapeutic order, so at the bottom of this triangle that you'll see, is establishing the foundation for optimal health. And so for me, what that means is we're giving the person all the tools that they need to be healthy. So whether that's health education, and we've seen that so many people are what we call that they have very low health literacy. So that means they don't really understand what it takes to truly be healthy. For some people, that may mean we have to teach them how to read a nutrition label. For other folks, maybe they need to learn how to cook. For other people, maybe they need to learn some stress coping skills, or prioritizing themselves and their own personal health. And so it's really broad, but establishing that foundation for optimal health is core. And so again, whether it's lifestyle, whether it's sleep or stress or exercise, that's the core. The other piece of that would be removing obstacles to cure. And what I mean by that is, so if I have a splinter in my finger and my finger hurts, well, I can take a pain med and make the pain go away. But if I don't remove that splinter, doesn't matter what the heck I do, the pain is still ultimately going to be there. And so by removing obstacles to cure, we are removing the things that may be causing more issues for folks. And then next up on this pyramid is stimulating the self-healing mechanisms. So in naturopathic school, we got a lot of Latin thrown at us. And so the vis medicatrix naturae is the healing power of nature. And so naturopathic doctors can oftentimes focus on the vitality and stimulating that natural vitality, whether it's helping to restore adrenal function, getting people to rest, getting some of those stress and coping mechanisms going on. Maybe it's hydrotherapy. There are so many different ways that we can stimulate self-healing mechanisms, supporting and restoring weakened systems, addressing physical alignment. So what you see is as we go up the pyramid, we're going higher in force. So we're using the most gentle, most basic of therapies first. And then as we go up with that pyramid, at the very top would be synthetic drugs and surgery and higher force interventions. And so, not that those are wrong. And, I think sometimes there are misconceptions of what naturopathic doctors are. Oh, you guys are anti-drug or you're anti this. And, honestly, at the end of the day, it's really what's best for the patient. And so if I've had people come in with acute illnesses where I had one person came in with acute appendicitis. Guess what? I will support I will support your healing process after we get the appendicitis taken care of. Another woman with an active miscarriage going on. Let's get you taken care of in the medical model, and then we will support you afterwards. And so I think that there is a time and a place for high force interventions, and there's a time and a place for lifestyle and wellness. And for the majority of illnesses that folks come in with, that bottom of the pyramid is usually a good place to start. So one of the things, and we're actually in the process of revamping this image, but I think it speaks to who's drawn to be a naturopathic doctor, and we're folks who we recognize that there are other ways of treating illness, and that it's not just the medical model. I think you'll see a lot of folks who are drawn to naturopathic medicine who recognize that nutrition plays a really important role, that the power of the mind is very important in healing, that prevention is important, that things like exercise and stress management and those natural approaches and herbs are things that are really powerful, and that's where they're drawn. And so that it isn't that it's us versus them or there is only one way. It's just that we recognize that there's another way that we would like to work with people. Oftentimes I've seen NDs have traveled abroad, or they've had, like I said earlier, personal health experiences or health experiences with family members that have shown them, wow, there's another way, and I want to choose that other way. So the accredited schools that we represent at ANMC are all across North America, and you can find out more about our schools on our website. So there's Boucher Institute, which is in Vancouver, Bastyr University, that has 2 campuses, one in Seattle and one in San Diego, National University of Natural Medicine, that's in Portland, Southwest College in Arizona, National University of Health Sciences in Lombard, Illinois, University of Bridgeport in Connecticut, and the Canadian College in Toronto. And so all of those schools can be accessed. You can get, if you go to our website and click on request info, you can select information from any of the schools that you'd like, and get some information on what the next steps would be for you. So we do have, actually, before I get to the events, I wanted to talk about, so I always think of, okay, I just talked about all of these things in naturopathic medicine and how we think and what we do and what have you. And so I had, it was really interesting. Years ago when I was supervising medical students, I had a husband and wife come in at the same time. And they were both sick with the flu. And the wife was a naturopathic student, and the husband was not. And they both came in, and I worked up each case individually. And the wife got a certain protocol, and the husband got a protocol of herbs and hydrotherapy. And it was really fascinating watching both of them because they both, basically got sick around the same time. They had, basically the same symptoms, but they were 2 different people. One was a medical student, and one was the spouse, actually a skeptical spouse at that. And so, at the end of the visit, the husband, had taken his herbs and had wrapped up, and he sweated and he did his hydrotherapy, and he came out of the room kind of in shock. He said, "My cough is gone, my runny nose is gone, and I kind of feel better." And he was, and as he was saying the words, "I kind of feel better," like you could see his face was like, I feel better. I don't know how in the heck I feel better, because I came in here feeling like death, but I feel better. And the wife, interestingly enough, and as I think about all of these things, and we think, we're talking about the vital force, we're talking about that innate ability to heal itself. The wife felt better, but not as much, and it wasn't as powerful a shift as it was for the husband. And afterwards, I'm like, okay, obviously everybody is individual, and we all have individual responses to things. But the other thing that I thought of is, here's a tired med student, and her body is going to respond a different way than maybe somebody who isn't as under stress of school. And so the main point isn't that don't go to school because you get sick, not at all. But it's that we have tools that can heal. And I think, ultimately, the beauty of the naturopathic degree is, you've got all of these extra tools in your toolbox. And so I had her come back in. I said, okay, it wasn't kind of this magic bullet like it was for your husband. And so we've got to do a little bit more nurturing for you. And so she came back in, and she was feeling a lot better within about a day. And so I think that there's, again, at the end of the day, for me, naturopathic medicine means that there are a lot more tools in the toolkit when you have when you've got something going on. And so with that, I'm going to go to the next slide, which whoops, uh-oh, where did it go? So the next slide is our upcoming event. So if this is interesting to you at all and you want to learn a little bit more, next week we have a virtual fair. And what that means is we've got all of our 7 member schools, and they'll be all online. So you can stay at home on your computer or on your phone and and interact with all of the 7 member schools and ask more questions. So if we're not able to get to any of the questions today, or if you think you have some specific questions for our schools, next week would be a great time to do that. We also have another webinar at the end of March, focusing a little bit more on the next steps and what it takes to become an ND. And so that in a nutshell. So I'm going to take a look. So up on the screen now is, and I have also put this in the chat box as well, our email address. So again, if you have further questions, feel free to shoot us an email over at info@aanmc.org. Our 800 number is 345-7454. And that will get you a counselor here at the AANMC. So with that, I am going to start taking some questions. Let's see, the first one I've got here. So first question, how is the buildup of emotions affecting the health of an individual? Well, that's not an easy question, but it's one that does have an answer. And so, if you think about it, our body is one big system. And so our emotions, so let's just take an emotion of anger. And so anger will cause what happens. What happens when you get mad? Face gets red, your blood pressure gets up. You've got, the stress hormones kind of pumping through your body. And that's a good thing. Fear, same thing. You can have, these visceral responses. And so when you have an emotion, there's a very, biological reason why emotions elicit physiological responses. And so when you've got an emotion, it's there for a reason. It's there to tell you, if you think of, caveman, cavewoman, fear was a real emotion. It was a good response to keep you safe and to keep you alive. And so a lot of the neurotransmitters, the endocrine system that gets charged up when we're scared, it serves a purpose. It keeps us from getting eaten by the bear, or from eating a food or that's going to hurt us. And all of those are innate things. But the biggest thing, though, with the buildup of emotions and impacting health is when those things get out of balance, or when you've got one emotion that's predominating and it's overwhelming our body's homeostasis, so our body's ability to balance things out. And so that is, NDs get counseling courses in school. We have lots of different ways that we're taught to work with mind-body medicine. Some folks will send patients for yoga therapy, meditation, mind-body medicine, breath work. There are all sorts of different ways to really work on that emotional component of health. Can you get these slides? Yes, that was in the chat box. These will be made available via video in about 48 hours or so. So another question, let's see, do naturopathic doctors have to do a residency? So residencies are not required in all but Utah. So Utah is the only state at this time that requires residency in order for licensure. How I did a residency, and I really do, I do recommend them for folks who want to go into clinical care. They're not necessary. But especially if you're looking at specialization, residencies can be helpful at giving you some of that, some more tools and some of the confidence. Again, though, they're not necessary for practice or for licensure, but they can be helpful. And the AANMC actually has just taken over the residency match process. And so on our residency section, we're going to be building that out in the next coming year. But we will be taking over the entire residency match come this April. Okay, next question. Let's see. Oh, what do I like most about using botanical medicine? Well, that's a big question. I think for me, so I was raised by a hippie mom, and so we had herbs around the house, lots of different natural therapies. You know, I used to have to hold my nose and take castor oil, which isn't an herb necessarily, but I think the fact with botanical medicine, when it's done really well, you can actually tailor the therapies to the patient. And so, you know, for me, it feels very often like, you know, if I know that a patient is dealing with an issue, I can come up with a unique formula for them using tinctures, using teas. And the other thing I love about botanical medicine is there are so many different ways. And so, you know, if tea is more your thing, then we can, you know, use teas, and it doesn't feel like you're taking medicine. You can use capsules. You can really tailor what the person needs using natural therapies. I also love the fact that we can get our healing from nature, and that's just always been something that I've enjoyed. Uh, and I hope I'm answering these questions enough for you folks. It's kind of hard uh, when I can't interact with people and see your faces nodding or doing this. So bear with me if I'm not answering your questions fully and you have any more afterwards. Please feel free to shoot them off at info@aanmc.org. Let's see. So. The employment opportunities for naturopaths is another question. Okay, so this is actually one that we're also working on building out our website on. So yes, there are lots and lots of growing employment opportunities for NDs. You don't necessarily have to go into private practice, and I think that, you know, when I graduated, you know, when I was in school over 20 years ago, really, you know, the model was, you know, okay, you're going to graduate and you're going to go into private practice. And for me personally, I always knew that I didn't want to practice 40 hours a week. Like that was just, I knew it in my core. I knew my own personality, and I knew for me, because I practiced such relationship heavy, talk heavy naturopathic medicine, that, you know, I could, it was really hard for me to you know, to see myself doing that 40 hours. And so I thought, okay, well, I really do want to be in more of an administrative role. I love teaching. And so I was able to come up with a career for myself where I saw patients part of the week and I taught classes part of the week. And then I gradually got into legislative work and policy work. And I was really fulfilled in ways that honestly, I didn't know that I was going to be when I was in school. But it was really, you know, it was very fulfilling work for me. And so I think that, you know, really with NDs, the thing that I love about the education, and, you know, and like I said, I graduated, I went to school over 20 years ago. You know, when I see my colleagues that are across the country now, across the world, honestly, practicing and all of the different things that they're doing, folks are able to craft their career for their, you know, their own principles, the types of patients that they want to deal with and treat, where they feel their strengths are, the types of things that kind of spark their brains and get them excited to wake up in the morning. And so that flexibility, of this degree, this one degree that you can get, where you can take it in so many different ways, I think is probably the biggest strength that I see for employability with NDs. So I have friends of mine who are in private practice, and they've either, they do general practice or they specialize in a specific area. And there are other folks who, I had one girlfriend of mine who just recently closed up a very lucrative practice. And because, her kids were grown up, and she's like, you know what? I want to see the world. I want to be able to, to travel more. And so she set up a practice where she travels, and she takes people on healing medical tourism. She just came back from hiking Kilimanjaro. It's kind of an amazing life. And so, I think, when I see naturopathic employment, we've got people who are writing, we've got people who are in academia, we've got people who are in public health system or research. And so there are so many different ways and career options for NDs that with this one degree, really it opens up the doors for so many different things. And I hope that answered the question. The requirements for getting accepted into ND school is the next one. And so that is, so first off, you need a bachelor's degree. And I will always tell folks, study well, and especially study well in your science courses. On the AANMC website, we have a section. So if you go to the section for prospective students, we've got a full section there for prerequisites. And so that gives you an idea of what you need to do prior to getting in. So I would say that's probably the best place for you to get started. Camila, I think it's Camila Santiago, Camila, the requirements for ND school. So if you go to the prerequisites page, that'll give you a good sense of what you need to do. And the next thing that I always tell people when they're asking about prereqs and requirements is go to the request info page, sign up, and talk to a counselor at one of the schools. Now, you don't need to pick a school right off the bat, but talk to some of the schools, find out, because every student is unique. Some people are coming right out of college, or they're still in college. Other people may be out of school for a while. And so, get some unofficial transcripts, have somebody take a look at them, and just give you a sense of, okay, you need to do this, this, and this to be ready to apply for ND school. And that would be the best advice I would have for somebody, is talk to one of the advisors, the career counselors at the schools, and just get a sense of what it takes for you to be able to apply. Let's see here. Okay, so question, is it necessary to attend the entire virtual fair? No, you can attend as much or as little as you want. I would hope you wouldn't be there for the whole day. It's, I think between the East Coast schools and the West Coast schools, it will probably be happening from like 5 in the morning Pacific to like 6 or 7 o'clock at night Pacific. So I wouldn't expect you to be there the whole time. Again, just show up as much or as little as you need. Take as long as you need to ask your questions. And if you do that quickly, then great. If not, we'll be there. So let's see. Okay, so next question is, what if somebody needs surgery? What would NDs do? So, I think, it very much depends on the type of surgery. We're talking elective surgery, we're talking emergent surgery. As I gave an example earlier, actually I gave 2 examples of surgical emergencies. One was appendicitis, and the other was a miscarriage, an active, about 5.5-month pregnant woman who was actively having a miscarriage. And so both of those, from my degree, I'm not trained as a midwife, and even if I was, that, I would personally be referring those out. And so, what I did was, I told the patient what was going on, or what I thought was going on, and I told them what was going to be happening next, and that my referral was to go to the emergency room. And I called up the emergency room. I let them know it was coming. Spoke to the doctors and communicated that. And so, I think the biggest thing is, there's no one doctor who's going to be able to do everything. And I don't have an ego big enough to think that I know it all. So, when something comes, and regardless of whether it's surgery or it's just something that's outside of my scope or training, or my skill set or my, my interest levels, I send it off. I think that, sometimes people get this sense of turf, like, oh, I've got to do it all, or, I've got to know it all. And you don't need to know it all. And I think if anything, it shows a sign of strength, in knowing your strengths, knowing your weaknesses, and knowing when you need to refer. And so our graduates are, they're taught when to refer, they're taught what's their appropriate scope. And so, if somebody is needing a specialist, whether it's a surgeon or an oncologist or an endocrinologist or, anything, a retina surgeon, let's say somebody's retina detaches, we're trained to know what the symptoms are, know what the signs are, and have a network of docs so that we can refer out. Um, So let's see what else. Let's see. What are your thoughts on? Gosh, there are a lot of questions. Oh my goodness, they keep coming. They keep coming. How do I go to school for naturopathy as a single mother? Oh my gosh. I was raised by a single mother, and I can tell you that single moms get it done. I think, when you want to get something done, you give it to a busy person. I would not take any type of life situations, as a negative. We hear from folks all the time with. With naturopathic medicine, and oh, am I too old to go to school? Um, and how do I make this happen for me? And what I can tell you, Natalia, is that as a single mom, obviously, your kids come first. But there are ways, and again, not knowing how old your kids are or what have you, but naturopathic school is challenging. One of my classmates was single mom to a child with special needs, and she made it work. I think just, obviously see what's realistic for you, but don't give up on your dreams. If this is something that you really want to do, and you're passionate about, uh, you can figure out a way to make it work. Obviously classes are rigorous, study time is necessary. I watched my classmate hustle, and not only did she raise a single child or a child by herself, um, but she also worked part-time as a nurse too while school. And I don't know how the heck she did it. But like I said, you want somebody to get something done, you give it to a busy person. And so I wouldn't let that stop you. Let's see. Are NDs allowed to write prescriptions? Yes. Depends on the state scope of practice, but that is something that you are taught in naturopathic school. Are NDs recognized as primary care doctors? What's the national landscape? So that's a great question. So NDs are recognized as primary care doctors in some states, and that is a state scope specific thing. So we are trained as primary care doctors, and specific states do recognize naturopathic doctors as primary care folks. The national landscape, I think, this was a really exciting year. So it was a busy year because I was putting out these press releases, but we just recently had two new states licensed. So Massachusetts was just licensed last month, and Pennsylvania got licensed toward the end of 2016. And so what we're seeing now is, and I've been doing these webinars for over 4 years, and I can tell you the interest is growing. There are lots of people who want to do this. It resonates with their own knowledge about health, with what they want to do for patients. And so when I think of the national landscape, it's looking favorable. Like we have new states in the pipeline who are going to be seeking residents or seeking scope expansion as well as licensure in the coming year. And it's really just, it's heartening to see, honestly, having been in this for a while, to see such a resurgence and a growth of interest and passion of people. So the next question is, can you practice as a naturopathic doctor in all of the states? We do have a map on our website. So again, if you go to the AANMC website, where we list licensure and scope for the states and Canada as well. So that's probably the best place, Brianna, to get your answer there. Next question is about scholarships. And so scholarships, again, best bet there is to talk with a counselor at one of the schools and figure out what the best situation would be for you. Many students do take out student loans. Not everybody does. So there are some scholarships available, but again, you know, it's all individual and you've got to qualify. Next question, if your state does not, let's see, another question about the virtual fair. So is there a schedule for the virtual fair? Yes, if you go to the ANMC website and you register for the virtual fair, it'll take you to the page where you can see the times that each of the schools is going to be there. Okay, there's a question about student research. So the question is, will students be able to conduct their own research during their doctorate program? So there are research requirements for all students throughout the course of the program. And some students go on and either do a concurrent master's, a research master's, or even some programs have affiliations with PhD programs where you can do a dual ND PhD with a specific concentration for research. So, you know, again, like I said earlier, with the career options, there are so many out there that really are, you know, available for students. Oh my gosh, I'm trying to get to the questions. I'm getting overwhelmed. Let's see here. Um, Next question on data about regions in the United States with the highest adoption of naturopathic medicine. Um, so when you take a look at the schools, obviously there is a larger propensity of schools on the West Coast, and you know I think when you think about cultural norms and you know, even just looking at census data for the healthiest states. So, you know, when you look at the US Census data or the Canadian Census data for that matter, on the states that have or provinces that have the highest proportions of quote unquote healthy people or people at normal body weight or the lowest death rates and so on, that gives you a general idea of what states, what provinces are more health focused. And so that would be the best place if you're looking for data on that to send you would be the census data. Okay, here's a great question. So I know there are so this question is about recommending for future doctors who want to open their own businesses. And so earlier we talked about the career options for NDs, and one of one of those options is opening up your own business. And so, you know, more so we're seeing folks coming into naturopathic school younger, and the average age has been coming down a little bit. We still have folks all throughout the spectrum, but some folks, you know, who don't have business experience, maybe they're coming in and they've never opened a business or they've never run a business, maybe they're right out of school. I definitely do recommend. So we are focusing on business curriculum now within the schools. I just actually came from a meeting with all of the deans last week, and we're looking at the curriculum, we're looking at the business curriculum specifically, and how we can help folks throughout the course of school get what they need to get. But I think at the end of the day, you know, everybody comes in with their own skill sets, and you know, some people are introverts, some people are extroverts, some people you know, come in with kind of that, you know, business sense, and some other folks have to work on it. And so I think, you know, the first thing for all of this is getting engaged. So every school has a career services department. And so, you know, I always tell students from day one, get plugged in. So if your intent is to open up your own business, get plugged in with the career resources folks. They've got resources, they have uh, you know, experts who they can connect you with. They can help you from day one of school get focused. And it's really funny because when I talk to the career resources folks at the schools, their biggest concern is students wait until the very end. they wait until they're like, you know, 6 months from graduation to come and see us. And so if I would say any piece of advice to prospective students, to folks considering this, or even students who are currently in it, go talk to your career counselor. They're there. They can help you. They can help you with resumes. They can help you with business plans. They can help you with all of that. And so more than anything, I think folks don't always take advantage of the resources that are available, or they don't think it's relevant soon enough. And so those business courses and the resources are there for folks who are interested. And again, if I could implore you all, go to see your career resources person. So there's another question. So are the schools full year or is there summer break? A young college student interested. So Victoria, some of the schools have different schedules. So some schools are on semester, some are on trimester, and some are on quarter. So in this case, I would definitely recommend that you reach out, go to Request Info, go to see, talk to the schools and see if there's a program that's going to fit your needs better. I know that some schools will allow a summer off in the beginning of the program, and then as you get toward the end of the program, it gets more intense and you're usually doing some clinical training in the summer. But again, it's going to vary a little bit on schedule from school to school. And so that, if that's something that you need for, whatever personal reasons, I would speak to the schools and see which one is going to be a best fit for you. Let's see. Oh, there's a question about a semester exchange. Kelsey, I would ask during the virtual fair about that. I know that it can be challenging because not all of the schools have the same curriculum. So if they all had the same curriculum and the same schedules, then yeah, that would be possible. Uh, there might be two schools. I know we've talked about that. We've also talked about it for faculty exchanges as well. But I would ask that question next week at the virtual fair. I don't want to give you misinformation. Okay, so I already spoke about that. So there are a couple of questions here about um, personal health and recommendations, and I'm not able to give treatment plans. I think, honestly, I've got about 5 more minutes left of the webinar. It wouldn't be fair to to any of the folks asking about personal health things to you wouldn't be getting the best quality. So what I would say to the folks who have asked about personal health concerns is on our website there. And also for the national websites, the American Association of Naturopathic Physicians and the Canadian Association of Naturopathic Doctors. What I would say is to go there and plug in find an ND and find one in your area. That will probably be the best route for folks who are asking for specific health advice. Oh, another really good question. And gosh, I'm trying to get to all these questions that I can. So how do you reach in-need folks who may not be able to afford your care? This is a personal passion for me. Years ago, I kind of coined this term "healthy for the wealthy" because I was seeing a lot of folks who were uh, more well off, seeking naturopathic care. And so I personally had a mission to be able to provide what I was doing to folks who didn't have quite necessarily the same financial means. There are nonprofits, and there are a lot of NDs now who are forming nonprofits to be able to provide care. Every single one of our member schools has at, at least one patient population that would be, an in need population, whether it's homeless or battered women, HIV patients, low income patients. Every single school has clinics set up. Maybe they're external clinics, but they've got clinics set up where you can get that experience in school. It does take, it does take a little bit of understanding systems and such to be able to do that when you get out, whether it's a nonprofit or whether it's moving to a state that you can accept Medicaid as a naturopathic doctor. There are a couple states that you can do that in. And so that's something that I would say if you're really looking for a disadvantaged population and getting this medicine to those people who desperately need it, it's really rewarding. The other thing that some NDs will do is they'll structure a practice where they have a regular fee schedule, and then they'll have a sliding scale for folks who can't afford care. Some people will have one day a month, or a day a week if they can swing that, where they see people for free or for a very discounted rate. Some folks will volunteer their time with organizations like Naturopathic Doctors Without Borders or Naturopathic Doctors International, where they can go and go to. I know there are missions that go to Haiti, there are missions that go to South America, missions that go to Mexico and provide naturopathic care. So there are a lot of different ways that you can do it. It's really understanding the type of practice that you want to set up for yourself, and the earlier you get a sense of that, the better off you'll be for really seeing your full potential as a naturopathic doctor. So the AANMC, there's a question about research, and we don't. So we're not a school. We represent all of the schools. So I think that the best thing, if you're interested in research, would be to reach out to the schools and see if they have any student possibilities. I know a number of the schools have full research departments and centers for research. So I would reach out there, as well as what's geographically close to you. So my friend who does the traveling classes, she does them all over Europe. She takes people to Germany. She takes people for biological medicine tours all over Europe, and I think she's going to start going to India and as well. There is a question about the commissioned core, and that is a good question. I don't want to mislead you here. Probably the best folks to answer your question here would be the American Association of Naturopathic Physicians. So Manuel, if you're interested in the Commission Corps, I believe that there is an ND who is I know for sure there's a member of a naturopathic doctor who is a member of the Commission Corps, but I'm not sure if he is a member through his naturopathic license or if there was another way. But I would reach out to the American Association of Naturopathic Doctors for that question. Another question that we get all the time. So do any of the accredited schools offer online courses? And so this is kind of a complicated question. So you cannot get your whole ND degree online. You're training to be a naturopathic doctor. You're training to be a physician. There is, like I said already, there's so much that happens hands-on. Training wise, we're learning physical diagnosis, we are learning manipulation, and so there are a lot of things that happen that are hands-on training. So you cannot do the degree online. There are courses, as all classes now are utilizing technology. So there are classes that you will take as a naturopathic doctor that may use what's called a hybrid platform. So, actually it's interesting, they call them reversed or flipped classrooms. So you may, do some of your didactic stuff online where you're, reading cases, you are, reading, doing your reading and doing that kind of stuff. And then you go to class to actually do the practical application of it. So you're still in a physical school. And we do get this question a lot, and there's some confusion because there have been in the past programs that are not accredited that have offered the naturopathic doctorate online. And I will say emphatically, actually, that these programs will not lead to a doctor of naturopathic medicine that will allow you to practice as a naturopathic doctor anywhere that is licensed or regulated. I've had students come angry, mad, they've lost money, they've lost time, because they've taken online courses. So there are not any online classes solely online for naturopathic medicine. However, our schools are obviously using technology. Technology is so amazing now, where 20 years ago, when I started school, the internet was kind of just barely there. So really what can be done now via technologies is so amazing. So somebody's asking for accredited schools and website. The website's our website. So I had a slide up earlier where the naturopathic schools were located. There is not one currently in the San Francisco Bay Area, but our website gives you a list of where the ND schools are located. And the Medicaid coverage, Emily, that would be something that the American Association of Naturopathic Doctors has more information on state scope. So I would go there. And I see some more questions about National Health Service Corps. I would direct those next week at the virtual fair, just because I know we're just about out of time now, and so I would say that the virtual fair next week will be a really good one for some of these questions. They will have admissions counselors present. They'll have probably some financial aid people there as well. So that would probably be the best use of questions. So I'm going to stay online a little bit more. I recognize that we are at time now, but I'm going to stay online for about the next 15 minutes or so, and try and answer as many questions as possible. And so for those of you I have not gotten to your questions, I've done my best. I'm sorry. Please send questions to info@aanmc.org, or stay on the line if you can for about 15 minutes, and I'll try and knock out as many as I can. Thank you so much for coming all, and I appreciate you spending some time with us today. Have a great rest of your day.